Are you dealing with knee pain or you get it on and off and there was no traumatic cause of your injury, no single event that you can pinpoint for the knee pain? What really happens a lot of times when we deal with these knee pains that really don't have an event tied to it is that it's an overuse strain. Okay, we like to categorize a lot of our sports injuries into traumatic or kind of a single event type of injury or overuse. Many patients come to us with knee pain that's overuse in nature. And so we're going to focus on that for today's video and the different types of knee pain issues you could have that stem from overuse during activities, sports, and even work, and try to give you an idea of how we can examine that, assess it, give you proper treatment for it, and prevent this from happening. Oftentimes, the knee pain is actually a reaction site to a faulty foot and ankle or a faulty hip. And so when we assess you, we really need to figure out if there's any issues in the foot and ankle and the hip, and then obviously the knee. We know enough to rule out any type of structural damage or to get you to an orthopedic or such to make sure that there's no underlying issues, but many times it's just a muscular or tendon type of issue that we can treat in our office and get you back to the activities you desire. So in this video, I'm going to demonstrate how we assess foot and ankle and hip and the knee, examine it, then give you some treatment options for it and also some corrective exercises that you can do at home to try to prevent this from happening. Hi, I'm Dr. Kevin Christie, and today I want to help you resolve this yo-yo effect of knee pain that you've probably been dealing with over time if you've been active. One of the early things we do, once we've ruled out any red flags in the knees, we want to check out some functional assessments and some movement patterns to see what is causing some pain in the knee. The first thing I'm actually going to do is check his one leg stance balance. That's going to give me an idea of how the hip is stabilizing, because if the hip isn't stabilizing, it's going to really chew up the knee a lot. And it's also going to allow me to see how the foot and ankle is doing. So let's go ahead and do a single leg stance. Good. And hold that. And I'm looking for anything where he can't do it, or there's a lot of shaking, or if the hip drops on the other side, that's going to show that there's a hip stability issue right there. So that's real quick. The next one we're going to do, I'm going to have you just on a single leg. I just want you to give me 3 little mini squats like that. Okay. I want to see if he can do it, see how the balance is and the coordination. He's struggling with that, as you can see, but that's okay. And then if there's any pain, you're going to stop. I'll ask if there's pain and where that location of the pain. As you see when I'll do the assessment, understanding where the pain is on that is going to help as well. All right, next one we're going to do is we're going to stand on one leg, and I just want you to rotate for me, okay? Good, and I want to see if there's any pain on there or not, and again, if there is any pain, we can assess that. Perfect. Those are a few of the functional assessment we do. There's probably more like 8 to 10, but you get the idea. We're really trying to see how everything's stabilizing, mobility, and if there's any pain on certain movements that'll clue us off to what's going on. Out of the gates, I'm going to really check some orthopedic testing. You know, we want to check the integrity of the ligaments in the knee, and so we're going to really run through a lot of different orthopedic testing to make sure the knee is stable and there's no structural damage. If we feel like there's any potential of that, we know enough to refer you out to a specialist that can really hone in on any structural damage that's going in there. So we're going to do some orthopedic testing on the knee. Then I'm going to start evaluating everything from the foot, ankle, knee, all the way up into hip. So one of the things I want to look at is the foot. Is there a really high arch or a really flat foot? Any of those types of things can cause extra stress on the knee. For instance, there's many different scenarios here, but if the person has a really flat foot, that'll tend to cave in when they are doing a stance or any type of single leg, and that'll put some extra stress on the medial knee here on the inside, because it kind of just caves in a little bit. Someone that's got a really high arch, I liken it to the kind of a pitcher and catcher analogy. If the catcher is catching the fastball, they're bending that elbow to absorb the shock. When someone has a very high arch, it's not absorbing the shock. So it would be like if that catcher was just, you know, catching that 90-mile-per-hour fastball without bending the elbow and shoulder to accept that force. And that's what a high arch does excessively. high arch will do that. So we want to check those out. I also will check ankle mobility. If we're lacking mobility in this ankle joint, that can also put extra stress on the knee. I'm then going to go up to the hip and see how the range of motion of the hip is doing. As you can, when we did the functional assessment, we were checking stability. I also need to check mobility in the hip joint and make sure everything is good with that. So I will check the integrity of the hip joint. Then I'm going to go to the knee. And what's interesting with the location of pain, because we'll get people that come in with overuse pain of the knee, no traumatic cause of it, and sometimes they'll have pain above the kneecap, sometimes it's to the inside, sometimes it's to the outside, sometimes it's below the knee, sometimes it's behind the knee. It could be a lot of different things. And typically, IT band syndrome is going to be some pain on the outside of the knee. Patellar tendonitis or patellar tendinosis is going to be right through here where the patellar tendon is, or even where it inserts. So we want to see where that is. Sometimes they have knee pain on here, and there's actually a big quadricep muscle right into there that can get a trigger point. That's called the vastus medialis. And so sometimes people are really concerned about their knee pain on the inside, but it really is just a trigger point there. It can be meniscus stuff. Again, we want to rule out any of those structural damages. And then sometimes it's just inflammation on the inside of the knee. And so we're looking for locations there. If it's directly in the back, the hamstring tendon crosses down below the knee, the calf tendon goes above the knee, and then there's also a popliteus muscle there, which doesn't mean a lot to you, but it does act in stabilizing the knee. And so a lot of times we'll see overuse and all that as well. So I'm checking the location of where this pain is. Then we're going to do some palpation to see if I find anything, and typically we can narrow that down. So again, we're trying to rule all the bad things out through our exam and history and consultation. If we feel like there's some kind of structural damage, we're going to refer out potentially. If we rule all that out, then we can start to pinpoint more of a muscular or tendon issue going on and then treat that accordingly. And one of the things that allows us to treat a lot of these knee conditions when we've ruled out everything else and it's probably muscular or tendon is something called active release technique. And it's a hands-based technique where we can find the issue and then actively resolve it. It's different than massage because there's going to be an active component. So I'm going to show you one treatment pass of that. And so a lot of times this quadricep gets really tight, and the quadricep has a tendon that it's on the top and then of the kneecap right there. So I'm going to just work on this area and show you what we're trying to do. So a lot of times there's scar tissue and some problems through here. We'll be able to find it. Then we're going to get a really good strong thumb contact on there. We're going to extend the knee. So this is in the shortened position. We're going to get right onto that trigger point, which you can probably feel. And then we're going to slowly bend that knee all the way to the end range. And this is an active release technique move. We would do that throughout any issues we found in the knee, but we're really trying to release any of the scar tissue or tightness that occurs throughout the muscles of the knee. And so this would be a sampling of what an active release technique pass would be. Good. Just like that. So our combination of the muscle work, checking out the foot and ankle, working on that as we need to, and then some rehab exercises really helps a lot of our patients that have these overuse knee conditions. All right, that's how we assess and treat the knee, and we've given you some stretches and exercise to do at home. If you'd like to get your knee pain evaluated and treated in the same day, you can give our office a call at 561-997-8898, and we'll get you onto the road to recovery.